I'm going to do the reproductive system, or continue on with reproductive system. We've already seen a bunch of reproductive anatomy stuff. In this video, I'm mostly going to be talking about venereal diseases, STDs. I'm going to do a mitosis and meiosis video as well, so watch out for that. So STDs can be viral, as you see here, or bacterial. And again, viral diseases cannot be treated with antibiotics, but there's some antivirals that you can definitely use to help treat the symptoms of these diseases. There are bacterial diseases, and since you can kill bacteria with antibiotics, you can use antibiotics against these. So the viral diseases we're going to discuss are HIV, genital warts, genital herpes, and hepatitis. Again, treatable but uncurable, or at least with antibiotics. And the bacterial diseases we're going to talk about are chlamydia, gonorrhea, and syphilis. So we've talked quite a bit about HIV. In the last stage of HIV, where your T cells are way diminished and you're kind of riddled with HIV particles, is called AIDS. And this leads to, it says, a suite of opportunistic infections. Basically what that means is secondary infections are going to come in and be able to attack your body because you don't have the T cells, you don't have your immune system to help you fight it. And I used to say there is no cure, but I've changed this to there is no common cure, because like we talked about in the past, there have been a couple of individuals who have actually been cured, but that treatment definitely is not for everyone. There is a treatment called HAART, and it's an antiviral therapy that limits HIV replication. And basically what this thing does is it inhibits many of the enzymes that HIV uses. It's multiple drugs all combined into one sort of cocktail, and it does a pretty good job of helping people to fight the virus, even after they've already progressed into the AIDS phase. So genital warts caused by HPV, or human papillomaviruses, transmitted through skin-to-skin contact. It can be transmitted even if you don't have any symptoms, and most people don't have symptoms of this disease. It is associated with cervical cancer in up to 90% of cases. What this 90% number means is that cervical cancer is thought to be associated or caused by HPV. 90% of cases of cervical cancer are thought to be caused by HPV. This is most often found with a pap smear screening in women, which is just a regular thing that your gynecologist will do when you go to the office. Unfortunately, HPV can be transmitted to a baby during birth, and a vaccine has been developed to help prevent cervical cancer as well as HPV itself. Next up is herpes, or the herpes simplex virus, or HSV. There are two types. Type 1 is found above the waist. Type 2 is found below the waist, which is genital herpes, is what we're talking about there. It is transmitted through skin-to-skin contact, and it can be transmitted even when you don't have any symptoms. Usually with herpes, you wind up with painful ulcers or these sores in the same places each time. Probably a lot of the people you know have the type 1 above the waist herpes, which tends to take place on the lips, but can also take place in like the nose or in the eyes. And outbreaks occur when the virus is reactivated. So if people are like stressed out, or if they get a sunburn, or if they have a fever, or if it's like finals or something and they can't sleep. There is no cure. Once you have it, you've got it forever. But there are drugs that can keep the outbreaks to a minimum or stop them entirely. And this one as well can be transmitted to the baby during birth. Hepatitis is simply an infection of, or an inflammation of the liver. 6 different kinds of viruses, A, B, C, D, E, and G. I don't know why they skipped F. Hepatitis B is the most commonly transmitted, sexually transmitted hepatitis. transmitted through sexual contact and by contaminated blood. So the same way that HIV is spread, you can get this if you share needles with someone. And it can lead to liver failure. So A and B now have vaccines. There's some stuff that you can do to try to combat this, but it's definitely a nasty one to have. So chlamydia, we're kind of on to the bacterial infections now. It's a very common bacterial infection, and some people don't have any symptoms. But if they do have symptoms, males are going to experience burning during urination and a mucoid discharge. So there's going to be some mucus. Females have a vaginal discharge and symptoms of a urinary tract infection. I don't know why I couldn't think of the word. But they have similar symptoms of a UTI. So UTI symptoms are going to be stuff like pelvic pain, increased urge to urinate, pain when you urinate, blood when you urinate, fun stuff like that. If the infection reaches the uterus, oviducts, and ovaries, it can lead to PID, which is pelvic inflammatory disease, and it can lead to sterility as well. This one can also be transmitted to a baby during birth, and it causes inflammation of the eyes and possibly pneumonia, which is like a liquid in the lungs, or fluid in the lungs. Gonorrhea. This is a common bacterial infection in everybody. Male symptoms, pain during urination, a thick greenish yellow penile discharge, which is my least favorite phrase ever. Penile discharge and vaginal discharge are my least favorite phrases. Female symptoms, it's uncommon to have vaginal discharge, but you're also going to have like pain during urination. It can lead to that pelvic inflammatory disorder, and it can lead to sterility. And it's very common for resistance to antibiotic, for this bacteria to become resistant to various antibiotics, which is very bad. And it can be transferred to the baby during childbirth as well. And it can lead to eye infections and sometimes blindness. Syphilis can lead to this chancre at the site of infection. A chancre is like a painless genital ulcer. This is a pretty common thing for syphilis. Stage 2 is a non-itchy rash found on the soles of the feet and the palms of the hands. It can also cause hair loss and gray patches on mucous membranes. Stage 3, which is much later on, it affects the cardiovascular and nervous system. You can wind up with big ulcers, and you can develop those on your skin and internal organs. So those stages are separated by latent periods that kind of make it hard to figure out exactly what you have. Maybe you think, oh, I was, just sick a few times in the last 20 years. But because of those periods of no symptoms, it does make it quite difficult to figure out what you have. And syphilis can get to a fetus as well. And interestingly, Scarface, Al Capone, died of syphilis in prison. So he died of this venereal disease in prison. Here's a nice picture of the bacteria that causes it. It's cute. Treponema pallidum, syphilis bacteria. So a few other infections of the reproductive tract. Bacterial vaginosis. It's caused by a disruption of normal flora in the vagina, leading to an overgrowth of certain bacteria. So, just some bacteria are growing sort of out of control. I didn't mention this, but it accounts for 50% of vaginitis. Vaginitis is just an inflammation of the vagina. It can result in discharge, itching, and pain. And the other thing here is trichomoniasis, which is caused by a protozoan, or Trichomoniasis vaginalis. Dr. Lisa Rishnick does research on this particular protozoan up at the University of Pacific. So I've had a few conversations with her about, a few bad issues. Interestingly, they've never seen this particular protozoan have sex, and so it's a sexually transmitted disease that they've never seen actually have sex. That's an aside. You also have candidiasis, which is an overgrowth of normal yeast in the vagina. This is what you might call a yeast infection, characterized by red, inflamed, itchy tissue. Sometimes there's a discharge. Birth control hormones and use of antibiotics make women more prone to this overgrowth because it's interrupting their the normal flora of their reproductive system, and it can lead to these yeasts just sort of taking control and overgrowing. So the best way to prevent an STD is to not have sex. It's just abstinence, but again, not always an option for everyone. Long-term monogamous relationships, assuming that you are both monogamous, is another great way to prevent STDs. And, you know, beware if your partner is using intravenous drugs, because STD prevalence is much higher in this group. Many of these are transferred via the blood. Practice safe sex. Always use a latex condom when you do have sex. Limit or do not use alcohol and drugs that can impair your judgment or change your behavior, which would lead you to do things like having less safe sex or engaging in sex with maybe someone you don't know.